so we come back to the drugs themselves, and then we also have prior authorization. It's cumbersome, right? Is there anybody who really sees a very clear, simple path through this, or is it always going to be this complicated? What do you think?
I think that fortunately for many, it works, I think is what we're hearing for this particular topic, that there are many people for whom they are able to get treatment pretty easily. And then I think it's the folks that we worry about are the ones that aren't treated easily, and they're the ones that have to go through these hoops, and they're the ones that have to deal with it. And I think that having that physician advocate, having that primary care doctor by your side, your organization as well, but I think that's how you get through this, is that partnership with your physician.
You could see a technological evolution. I mean, if the prior auth requires a certain number of days of headache, for example, or previous therapies, you could see, you can see apps taking on much of the role of the diary app, which is useful at any rate, having a facilitatory role, linking up with what the insurer wants. I mean, it's good medicine in headache to have a careful diary. It's good for the patients, good for the doctors, and actually it could be very helpful in terms of communicating with insurance companies. So I do think that our interests are aligned here. Patients want to be better, physicians want to make them better, and frankly I think payers want them to be better, because a patient who's better ultimately is working and contributing and not going to ER. So I don't see I don't see that's a problem. The administrative side is, and okay, I'm weak for ducking it, but I do duck it. But I don't think these are insoluble problems. I don't think anyone hates anybody, and I don't think anyone hates the patients or hates insurance companies. And I think we could. I think probably there are technical ways of making this a bit easier.
I agree. I mean, for example, with the prior auth, I mean, we're working to get access to electronic health records, which would mean patient wouldn't really have to do much. Physician interviews the patient and sends it off, plan sees it and approves. And so I think we are getting to a better world.
You know, I just make an observation. I do a fair number of these panels. This is the most collegial group I've ever seen. We have had panels where people have been open fire on each other with this.
We want to do good.
Yeah, well, everybody
and
seems
there's
to
a
want
big
to
opportunity here. There's a big opportunity to do good. Certainly in the headache world, I think we're quite a collegiate bunch. We would like to do good.
Well, apparently this is great. And if I may, what struck me when you were discussing the apps is it's a patient's own personal private executive electronic health record.
That's right.
And you could wouldn't it be great if you could link that in some secure method with 22 passwords, which you have to change every 35 microseconds, to put that into your electronic health record.
Yeah, absolutely.
That would help, wouldn't it?
Right, and that's part of our future vision as well, too. We're very focused on HIEs and trying to get to that point.
And by getting patients involved in their own care, it gives them some agency, gives them some control, helps them to communicate better with their physician, and patient-physician communication is really key.
And that's going to get at that underdiagnosis problem as well, too, because I think that's part of the issue, communication.
It seems to me the biggest risk for these apps is looking at your app while crossing the street.
Yeah.
Which, I don't know where you live. Where I live, it's a massive problem.
Or not opening it to begin with.
Or not opening it.
There's not much chance of that walking down the street these days.
I mean, everybody's on the phone all the time. That's a public health crisis which we're not going to solve today. But are there specific apps, by the way, I'll put you on the spot. Are there specific apps that you know of that you like?
Well, I like Migraine Buddy.
Migraine Buddy?
Yeah.
Really?
Like My Fitness Buddy.
My Fitness Buddy.
So
That's one?
Yeah.
Migraine Pal, they're really...
Migraine Pal?
Yeah, you just look for those kinds of diaries on your Google Play or your App Store.
And you just put in migraine and it'll come up.
Yeah.
Is anyone better than the other?
Well, I've only used it. I found Migraine Buddy quite useful. So I mean, you could use 10 different apps. But I found that one. I don't think there's. Find one that makes it comfortable for you, and a patient should use it to get better care. You see it as a tool to improve communication and care.
Right, because an app that you don't use is the same as an app that doesn't exist.
Yeah, totally.
Right, it's like
Even
the drug
worse.
that's on the shelf.
Yes.
And you're not taking it for whatever reason. And people taking meds has always been an issue, right? Compliance is a big problem, even for headache.
Yes.